Chief Oliveira, thank you so much for joining us.
Thank you very much. It's a pleasure to be with you.
More than half of the world's population lacks access to basic health care. December 12th marks International Universal Health Coverage Day. What would you say are some of the biggest barriers for people? Why is it still so difficult for people around the world to have basic health care as a human right?
Well, there are many reasons for that, but one of the important reasons is the lack of priority that is given to health in general and specifically to the area of mental health. If more resources were devoted to the expansion of primary healthcare services, if more resources were put into specific projects that target the diseases that have higher mortality or highest burden, like non-communicable diseases and mental health, we believe that the situation would really change.
This year, the theme is unaffordable health costs. We are sick of it. And one line that stands out in this campaign is unaffordable health costs are making our communities poorer and sicker and holding us back on all of the sustainable development goals. What do you think are some of the steps that could be made to make healthcare more affordable? I mean, is this really something that governments need to do? Is it their responsibility?
Yeah, we really believe that this is an area that governments need to take very seriously. Unfortunately, in some countries, people are not able to pay for a medical consultation or cannot pay to the cost of medicines. And by changing that, we can hopefully improve the situation and move towards universal health coverage, where everyone can have access to health care without posing a burden in themselves and in their families.
And are people still wanting to go into healthcare to help other people? Is there any issues with people, maybe not enough people rather, to help others in mental health or in medical care?
Well, in mental health, definitely this is one of the problems. We don't have enough specialists to deliver the mental health care that the population needs. But on the other side, there are alternatives. We know from the evidence that exists that it's possible to shift tasks to non-specialists, and this can be also effective. So in the past, we used to rely on psychiatrists and psychologists to deliver mental health care. Today, we know that nurses, even laypersons, counselors, if well trained and well supervised, they can deliver care that can be as effective as when it's delivered by a specialist. So that's an area that we have been stimulating countries to adopt such strategies and approaches, because even rich countries don't have enough specialists. Look at the burden of depression, look at the rates of suicide increasing. Specialists are not enough and will not be enough. So by shifting care to other areas, training, capacity building, supervision, that's the way to go to address the burden of mental health conditions.
We know that suicide is the third leading cause of death for young people aged 15 to 29 in Latin America. Tell us about the correlation between mental health and suicide rates in the region.
You bring a very important topic in the region of the Americas. It's not only the fact that it's the third leading cause of death among young populations, but the region of the Americas also is the only region among the different WHO regions where the suicide rate continues to increase. In fact, there has been a 17% increase in the regional suicide mortality in the last 20 years. You have very high rates in the Caribbean. You also have high rates in North America, and in the Southern Cone, you have countries where suicide continues to increase. There are many reasons for that. They are particular to each of the different countries, especially because some countries, it's young populations that die more by suicide. In other countries, it's older populations. So what we really believe is that suicide and suicide prevention needs to be taken seriously, needs to be at the top of the public health agenda of countries so they can implement strategies that can change this situation. Because the most important is to know that suicide is preventable.
preventable. Tell us about the aspect of mental health with what you're seeing.
Yeah, mental health is one very important part of suicide prevention. We know already what works. What works is limiting access to means. It is also media communicating responsibly. But when it comes to mental health, there are two types of interventions that are very important. One is to work with young people at schools, improving their capacity to deal with the adversities of life. So this is an area where we try to increase resilience, improve mental health in a way to reduce suicide. And the other aspect of suicide prevention that it's very connected to mental health and to mental health services is the development of services that can identify people at early stages of a crisis or suffering and provide mental health support, follow-up and care in a way that the issues that people are facing that could lead to suicide are addressed as early as possible. If we are able to implement those strategies in countries, we know that we are going to be able to reduce suicide.
What was the impact of the COVID-19 pandemic on mental health in the region? And now that we're coming out, we're a few years away from the pandemic, are you still seeing impacts? And really, what have you learned from that?
That's a very important question. We have worked very hard during the pandemic. And at the beginning, we were able to put together some studies that showed that in the region of the Americas, conditions like depression and anxiety had increased. And that allowed us to alert the countries that they needed to do something, that they needed to expand services or avoid that services were interrupted. So since the beginning, we were able to have a picture that the situation was not good for mental health. And there are many reasons for that. After COVID, countries, I think they learned that the importance of mental health in people's life. Mental health got much more visibility. So we are using that opportunity to help countries to reinforce their capacities to deliver mental health.
How much of a challenge is funding when it comes to, these mental health initiatives and it becoming integrated into a national healthcare system?
Well, this is one of the biggest problems that we face. We also compare data on the proportion of funds from the national health budget that countries were allocated to mental health. We compared the data 2 years ago against recent data, and unfortunately, we didn't see major changes. So it's still a very small proportion of the health budget, which is, it's very sad to see that, because despite all the visibility that mental health has had, the commitments of governments, the commitments of head of states, we haven't seen the change in the allocation of resources. If you also look into the international scenario, mental health is an area that unfortunately does not have like international funds or commitments of institutions towards putting more money into mental health. And this is an area that definitely needs to advance.
Chief Renato Oliveira, thank you for joining us.
Thank you.